Hello people, welcome to another case discussion in emergency. So basically you are at this place where there has been an avalanche 20 minutes before. So there's an avalanche and then you reach there. So you're a part of a search and rescue team which is looking for trapped skier, okay, following an avalanche 20 minutes prior. Okay people. Now you have been instructed by the team leader that if you find a patient, then you should move them very carefully. You should not move them suddenly. No excessive movement. Otherwise, what will happen? You will induce a cardiac arrhythmia. Okay. So you should move the patient very slowly, carefully. You should not have excessive movement. The question for you here, MCQ, is below what core temperature can ventricular fibrillation be induced from excessive movement? Below what temperature can you cause a ventricular fibrillation from excessive movement? Below what temperature? So look at the options here: 36, 32, 35, 30, 33. All these are in centigrade. 36 is kind of a normal temperature that we live at, right? 36.5 to 37.5. This is not the answer, I'm sure. 35 also is very much around the corner. So it should be one of these. Somehow I feel 33 also is not something that is that low probably to cause a. So it should be one of these. And the answer here is D. That is 30 degrees centigrade. Okay. So please understand that a ventricular fibrillation may be induced below 30 degrees if you excessively stimulate that person or there is excessive movement. So that is why when you are handling hypothermic patients, you should handle with great care. Okay. So what happens when the temperature falls? There's a reduction in the cardiac output, okay, with the initial maintenance of the stroke volume. So cardiac output will reduce, then heart rate is reduced, right? So there could be sinus bradycardia, atrial fibrillation, ventricular fibrillation. So you don't go and induce a ventricular fibrillation by excessive movement. So that is your emergency tip for today. So the case discussion on this avalanche is done, okay.